everybody. So I'm Sally Hogg, the Senior Policy Fellow at PEDAL. And what that job title means is that my role is around thinking about how do we bring the latest evidence from our research, but also the massive body of knowledge that our academics have within PEDAL to support policy and also practice and decision making across the system for children. And it's kind of working two ways, so working with the academics to think about how research is shaped and to build their capacity and confidence to talk to policymakers, and also helping policymakers to find and navigate the research and to connect with academics. And one of the things Helen mentioned earlier about the kind of value of partnerships between academia and the voluntary sector often being incredibly good at reaching and communicating with a range of different audiences, and we can bring a kind of level of expertise to support the work that they do. And this project that I'm going to talk about that we did with UNICEF is an example of that. So UNICEF have a broader campaign, Early Moments Matter. A lot of these things use very similar language. Early Moments Matter at the moment, which is about campaigning specifically for what they're calling a baby and toddler guarantee. So a kind of core set of services that every young child across the UK can receive. But as part of that, they're also doing a range of other work to support change within the system. And they came to talk to us about what we might do to support particularly local areas and all of the different array of services around children and families that can support their mental health, to do more to support mental health in infancy and early childhood. So looking kind of from conception to 5 in particular. So I'm going to just talk a little bit about the toolkit today. That's the URL, we can see it. It was one of those projects where we started thinking, oh, we'll just do like maybe 15 pages, something really short and snappy. It's 105 pages because every time we shared it with people, they said, this is great, can we have more on that? So it's huge, and I'm not going to try and talk to you about it today. I know everybody's really hot, and I'm just going to do a bit of a whistle-stop tour, but I'm going to let you know what's there so that you can go and kind of have a look around and see what might be useful for you. It's very much designed as a set of tools to support local discussions, to support local understanding, and to signpost to some amazing resources that already exist that we didn't want to replicate. So why did we do it? Well, we know that early mental health matters. We know that the mental health of our babies and young children is incredibly important in its own right, and because it sets the foundations for their later development. And that no single service or single professional in a local area can or should be responsible for supporting children's mental health. Actually, lots of services around a child and family will support their mental health in different ways. So people need to be able to work together at different levels. That means practitioners working together, it means local decision makers planning and thinking about how they spend money together, and it means national government departments being able to talk together as well. And one of the things that we were seeing, having worked in this space, is that actually we don't really understand what we mean by mental health in a lot of cases. So Yoshi said earlier about, there are many definitions of these things as there are Cambridge departments, and there are, and we don't, and there are reasons behind that why different people need their ways to define things and talk about them from their professional background. But actually we need a shared way of understanding things if we're going to be able to work together, either to talk about a particular child and their needs, or to think about a whole system and a place of children and what we collectively can do. So the toolkit was aimed to do that, to think about how do we create a shared understanding of what mental health means and what we do about it in a local area. And it has a number of frameworks and tools within it to support that, but very much recognising, I guess, some of the themes that's led today, that actually local places, local communities often need to define these things themselves. But what we can do is provide a kind of framework and a starter for 10 that aids those discussions. And also just surfaces why some of this stuff is important and why it's hard. So I've talked about this, but that's what the toolkit aims to do. So to create that deeper shared understanding. So I think some people kind of want an obvious solution, and that, you know, other places have service specifications you can use or interventions you can download. They all exist and they're wonderful. This doesn't provide those. It's not a kind of exact how-to guide about what you want to do. It's much more about a tool to use to facilitate local discussions and partnerships and to build a deeper understanding as the foundation for all of those specific activities. So it is very hard for people to find a shared understanding of mental health in early childhood. As I've said, because professionals come to thinking about mental health from different perspectives. They have different vocabularies. They might talk about social and emotional well-being. They might talk about mental health. They might talk about early relationships. Professional training rarely covers mental health in the early years, because if you work in the early years professions, mental health is rarely talked about, and if you work in mental health, early years, and particularly really little children, are very, very rarely talked about. And so we've got this kind of gap where nobody is kind of thinking about mental health in the early years and have that basis on which to really understand what to do about it. And we do have a lot of concepts about what mental health is and what mental health means as individuals, as communities, as the general public. And some of those, and as professionals and services, and some of those really don't translate to babies and young children. And so there can be some real dissonance when we start to think about the mental health of babies and young children. So a couple of examples of this. This is from some work I did in a previous role at the Parent Infant Foundation, just to kind of highlight those issues that people have thinking specifically about infant mental health. So the first two are, I had the pleasure of meeting online the Princess of Wales to talk about infant mental health, and there was a tweet about it, and some of these, you know, normally you get some Twitter coverage from some people who actually know about what I'm talking about, but you suddenly get the general public kind of wading in, and actually so it really surfaced what people thought, and you got this kind of, well, what the heck are you talking about? What on earth is infant mental health, and kind of, how dare you even talk about the mental health of a baby? What are you saying about our babies? But we also did research with commissioners and with policymakers and politicians, and actually, although they weren't quite as upfront about kind of raising questions about it, there was still that kind of real confusion. What really are you talking about here? What does it mean? I don't really understand. I kind of get mental health, but it doesn't really apply to babies. I don't really know what you're talking about. And that really kind of either creating a sort of visceral discomfort that makes people actually really not want to engage, or just a basic level of confusion, which makes it hard to have a kind of useful conversation. So I think we have to own that and kind of deal with it, and that's what the toolkit tried to do. So here are some of those different words and language that we know that people use when they're talking about mental health of babies and young children. And we, you know, these do work for people. We don't want to say kind of, oh, slash those out, let's start talking about something else. But what we wanted to do is to kind of create a framework where people could see that these are also all ways of describing mental health, and that actually we're talking about very often overlapping or similar concepts. We had some debate about, do we talk about mental health? Should we go a bit softer? Should we talk about emotional well-being and emotional health? And again, there's a really strong case for doing those things, but we decided not to because we really care about parity. And actually what often happens, I think, is if we talk about mental health of children and young people and adults, they have a mental health minister and mental health services and mental health funding and commissioners. If we then say, well, the young children have got emotional health, it's not quite as important and it doesn't get the same response. So we thought that actually using the language of mental health was really important for that parity. So what some of the misconceptions that we were trying to tackle with this, and these have come out of a range of kind of particularly public perceptions research from organisations like Frameworks about why people find it, what people really understand when they use the term mental health, and then why that is then difficult to apply to babies and young children. So when we use the term mental health, very often it's taken to mean actually mental health problems or diagnosable disorders. And because babies and young children tend not to have diagnosable disorders in the same way that adults do, that kind of understanding of mental health makes it difficult. If we actually talk about mental health in the same way we talk about physical health as a positive state of being, then actually it becomes much easier to talk about mental health for all of us and for our babies, and it makes more sense as that kind of positive idea of mental health. The framing research shows that in public kind of terms, often mental health is seen as a kind of a deficit in individual. You have your mental health problem. And again, people kind of find that very difficult for baby. You know, you're labelling this child, you've got a deficit, and of course baby can't have their own mental health. It's all about actually how their parents or their situation. Well, actually that's true of everybody, right? And actually, you know, changing that as for all people is useful. So actually, if we start to talk about our mental health is our response to a range of things inside and outside, a complex interplay of factors. Let's understand it in those terms, and then again it feels more comfortable to talk about a baby and their relationships in the world around them. And then finally, that idea that actually if we talk about the mental health of baby, we're somehow giving them a kind of label and saying actually this child's got poor mental health, as if that's going to then stick with them for life, and it's a kind of real deficit deterministic model. But again, as for all of us, if we see our mental health as a journey that goes up and down throughout our lives, what we're saying actually is this child has got a particular set of needs now. And if we act, and if we respond to those needs, then we can actually improve their mental health. And actually, as opposed to being deterministic, we're putting them on a positive trajectory. So that's what we were trying to do in the way we talk about mental health and the framework that we created. So this is the framework. And it's detailed. It's not a kind of single definition. What it is a kind of a tool to aid understanding and aid discussion. So it has two kind of broad categories, being and becoming, and I'm going to talk about that in more detail why that matters. And then it splits mental health into three parts: emotional, social, and behavioural. So we recognise that those overlap and often are displayed through each other. Children's emotions are displayed through their behaviours. But again, it's a way of, what we did was look at the different ways different people talked about or acted on mental health and thought, okay, can we map onto here the different aspects of the early years foundation stage, or the different ways in which mental health services are working with families, and do they all pick up on this? So the being and becoming thing was particularly important because one of the issues, I think, in the mental health space is that in the infant mental health space is that we have for many years been making the case to act in the early years by talking about how if we get things right in the early years, we lay positive foundations and we create children who learn better and adults who make more money and people who are healthier, and we lose a baby in their own right. We talk about the early years purely in kind of utilitarian terms. And but having said that, we do know the early years are really important for everything that happens next. So the being and becoming aims to create space for both of those things, where we say actually children are mentally healthy now or not. They might have struggles now. And those matter, and they matter in their own right, because children have got a right to be healthy, just as we all have a right to be healthy. And I don't want to, if I go to a GP and ask for help, I don't want anyone to be making calculations about, does she have this mental health treatment because will it make her more productive in a few years' time? I have it because I need some help now. And so this creates that space where children also need support now, but also we recognise that they are developing a set of capacities that will enable them to be mentally healthy in the future, and we hold those two things together. The framework recognises that every child is different, and we talk in the wider toolkit a lot about neurodivergence, about cultural differences, and we also recognise that what it means to be mentally healthy will change a lot over the course of development, and that particularly in the earliest months of life, being mentally healthy is incredibly dependent on a relationship. You know, the Winnicott quote, there isn't, you know, this, a child doesn't exist without that relationship, and that actually as children get older, their mental health exists more, it's influenced by the relationships, but it exists more in its own right as an individual. So we do recognise that there's variety, and what the framework tries to do is to create a kind of broad enough concept onto which we understand that every child's, what being mentally healthy will mean is different for every child. And then, as I said, that there are those three different elements, emotional, social, and behavioural aspects of what it means to be mentally healthy. And you'll see that we include playing in here as a manifestation of well-being, that actually to be able to play is to be mentally healthy, but also that if we are mentally healthy, we are able to play. So we're making those links about play and mental health within the framework as well. We are very clear that kind of you can't just look at child's mental health on its own in isolation, that there are that it exists within the child's physical health, their nutrition, their safety. And so we kind of use the nurturing care framework as that way of saying actually mental health exists within the concept of a child's full all needs being met, and the two are very dependent upon each other. We have a number of kind of tools and worksheets and examples in the document. And what we really try and do with those is to use the child's voice and also to kind of make the point that actually being mentally healthy is different from behaving well, from being compliant, from a lot of the kind of concepts that people have. So I really like some of these examples, and Beth was really fundamental to kind of writing some of these about actually, so I'm 2.5, I get frustrated when I have to do something I don't want to. Today I cried and lay down on the ground because I didn't want to walk home from the park. My grown-up understood I was tired and sad to be leaving. They gave me a cuddle and told me I'd done a great job walking so far and reminded me we could come back tomorrow. That helped me feel calmer, and I stopped crying and continued walking for a bit, and then I asked to be carried the rest of the way. So we're showing that actually this child is a mentally healthy, developmentally appropriate child. They're not necessarily a child that's really easy to parent, but those are different things, and actually that's really important in kind of giving these children agency and kind of, I guess, tackling some of our misconceptions and inappropriate expectations of little people. But also within all of these examples, in the italic text, you'll see actually that we really pull out that role of grown-ups, that actually this little person couldn't be mentally healthy on their own. They needed that grown-up to kind of to remind them, to cuddle them, to help them regulate their emotions and kind of scaffold them feeling better. So the framework and that kind of description of mental health, which is sort of all we wanted to create when we first started, is just a part of this toolkit that then grew and grew. And there are other sections in there. So there's a case for action, a socio-ecological model. I'm going to touch very briefly on both of those. And then there's also sections on the importance of a whole system approach, workforce measurement, which Christine and Beth were really key to writing, and a key concepts like a glossary for people, because again, you go to these meetings and actually professionals are bandying around terms without necessarily having that shared understanding of what they mean. There are lots of tools, so this one in the corner here is a set of scenarios, and these again describe little people who are having a tough time in their own voice, and they often and they are used for a local area to discuss together. Would we know this child was struggling? Who would know? What would we do about it? Do we have support in place? And they're, again, part of that toolkit to support constructive local discussions about, have we got the right support in place? Are our professionals skilled enough? Are we able to support young children's mental health in a way that isn't starting from an adult and service-led perspective? So the case for action, again, reflects that being and becoming bit that I talked about before, because I think we've been making the case for action around early years mental health just too much in terms of the foundations for later development. We do that, and we point to some brilliant resources that exist to do that, but we also talk a lot, and this is the pleasure of working with UNICEF, is our ability to talk about children's rights and the right to be healthy, and we make that very clear. And we also make this last point on here that actually if we're paying attention and being curious to a child's mental health, it can give us clues about other things that are going on. And this really resonates with me. I read the awful case of Star Hobson, who was a little girl who was murdered by her family. And in that, it talks about how her grandparents and others recognised that she was sad. And it always hit home to me that actually, if someone had really recognised that she was sad, she was telling us a lot about what was going on in her life. That was, there were so many clues including into her mental health and emotions. And actually, we can find out so much more about the support and the context of children who can't necessarily tell us things through their words, but are telling us through their mental health and how that manifests in their behaviour. And then, I know everybody's wilting, so I'm going to finish, but we also have the socio-ecological model to talk about all of those different, again, getting away from the fact that this is just about a deficit in a child, but talking about how a child's mental health is affected by all of those layers around them. So this is the onion. And one of the things that, so UNICEF use this model a lot, but with a bit of kind of advocacy with the New York office. I had a kind of call with New York. We got this extra layer put in. which I was really proud of, about relationships, because actually family and caregiver situations matter. You know, whether or not mums have got a mental health problem or whether there's domestic violence at home, those things are critical to children's mental health. But we know the main mechanism through which they act on children's mental health is the relationship. And we know that even in a context where we can't necessarily sort everything out about a family's difficulties in a family's life, we can support early relationships, and that's a key tool to support mental health. And even if we do sort everything out in a family's life, or if they manage to resolve issues, unless that relationship is held and nurtured, then we can't do everything we can. So bringing the relationship to the fore was also an important part of this model. So I'm going to just skip that. And what the toolkit aims to do, and particularly linking to that socio-ecological model, is encouraging professionals to be curious and work together to think about problems and challenges that a child might be experiencing. So we talk a lot, again, about kind of what's normal, that actually, you know, it's not a mental health problem if a 2-year-old is having tantrums. That's a very, very normal part of development. But if there are significant and persistent issues, then we do need to be curious about what's happening for that child. And the socio-ecological model provides a tool for professionals to think together about, actually, why is this child acting in this way? And the same behaviour that an early years setting or a health visitor or someone else might be seeing might be the manifestation of different things in different children. And this was something that when we were talking to local partners and practitioners, they often said they really welcomed, because post-pandemic a lot of early years settings were having children who were struggling with their emotions or their socialisation, and we're saying, actually, you know, we need to get a diagnosis for this child, we need to, and in some cases that was the right case of action, but actually they weren't stopping to be curious about what might be the other reasons why this child is acting like this. What was their experience of being locked down? What's going on in their home? How do we talk to the other professionals, the health visitor, others who might understand something else that might give us different strategies in order to support the child's mental health? And so we've got kind of case studies and talking points to try and aid those local discussions and that understanding about actually how do we collectively work around a child to understand why they're having the challenges they are and what best we can do to support it. So that's it from me. As it's very hot and we're already running a bit behind time, I'm going to stop there and let you all go out and grab a drink, and I'll just hang around, so if anyone's got questions you can just come and talk to me individually. Thank you.